Time for tonight's Sterling Health feature with Travis Sterling of Sterling Physical Therapy, who's contracted with Pella High School for on-site injury evaluations. And tonight is one that I think everybody in the audience can relate to a little bit, and we're going to talk about low back pain. I guess, Travis, what are some considerations from an athletic standpoint that you have to deal with when talking about back pain?
We get a lot of athletes, whether it's at the high school or just in the clinic, that'll complain about, hey, my back hurts. And, obviously considerations are you need to talk about the sport. You have different sports that are high impact, like football, basketball, where there's a lot of pounding on the back, or you have more endurance type sports, cross country, distance runners. And then you have like wrestling is kind of a hybrid because there's endurance and high impact. So we have to talk about obviously the sport, the type of position they play, and then the type of symptoms they're having. And we always want to rule out bad things first, and then based on what we find, then kind of go to the next step.
So you rule out the bad things, then what are some things that you might be looking for, whether it's an athlete or if it is just, again, that weekend warrior, mom, dad, grandma, grandpa that's just having some back problems?
Probably the most common thing that we see is, a sprain or strain. So an athlete moved differently than they were used to or got in an awkward position, and the muscle got stretched farther than normal, or a ligament or a tendon. So that's the first thing. Otherwise, then we'll look at kind of the bony anatomy and the joint. There's 2 joints for every level of your spine. So we want to look and see if that's involved. And with all those things, there's always an inflammatory component. So we'll be looking at that component of it as well. And then that'll give us kind of a guideline on where we need to go from there.
And then what type of treatment do you offer, again, athletes and non-athletes alike? Is it different?
Really, it's not different in the fact that we're still going to try to tackle the swelling and inflammation and pain initially. And then we're going to look at, are there underlying causes, i.e. things that set them up for the problem, and then address those, and then finally, give them tools or things that they can kind of continue to do on their own to help prevent further issues. And then one caveat, obviously, there's some things that we might not be able to handle here, so we have connections with orthopedic surgeons, whether it's here in Pella or up in Des Moines, and sometimes we have to utilize those for more serious issues.
I'd like to say thanks to our guest on tonight's Sterling Health feature, Travis Sterling with Sterling Physical Therapy in Pella, where they provide you with the Sterling standard of care.